Those words by the American author are clear attestation of the fact that although good health cannot be bought or paid for, but having it can really save a lot of resources, including money and time. This may have been the driving philosophy of the Lagos state government in the area of providing good qualitative healthcare services for the good people of the state. With a population of about 23 million people, the state daily faces cases of health conditions that get out of the hands of individuals to manage by simply dipping hands into the pockets. Treating or managing some health conditions may be affordable for certain individuals, but to many others it is an extra concern that should not be added to the challenges of living in a cosmopolitan city like Lagos. It is more challenging when you have a young and growing family. To effectively help residents manage this concern and align with the goal of the World Health Organization to ensure that everybody had access to affordable health care. The state government has committed a lot of resources to the establishment of a state-owned health insurance program, which is the nation's first of its kind at the state level. As globally practiced, the concept of the Lagos State Health Insurance is to create a coverage that provides for the payment of benefits as a result of sickness or injury to subscribers of the scheme. The scheme, which is a statewide mandatory and prepaid health insurance, is aimed at providing financial protection against catastrophic health care spending. The scheme covers treatment of common adult and childhood ailments like malaria, typhoid, measles, and immunization, among others, maternal and child services, preventive health care services, selected non-communicable diseases, and surgeries. Do Lagosians really want a thing like this?
Will it be something everybody can afford?
I think the health insurance is long overdue and it should be incorporated.
Dr. Peju Adenusi is the General Manager of the Lagos State Health Management Agency, otherwise known as Lashma, an organization designated to implement the state health insurance scheme. She has more information than the man on the street.
The objective of the scheme is bound on 4 pillars. Looking at the issue of equity, which means no matter who you are, as long as you're a resident of Lagos State, whether you're poor, whether you're rich, you should be able to access quality healthcare services. So the second pillar is the issue of quality. So we're not just saying healthcare services, but the promise is quality healthcare services. We're also looking at the issue of accessibility and affordability. If you look at the premium that I've told you about, it's 40,000 per year per family. If I look at a single health condition or incidence, so I take, for example, something that is common, maternal care, the issue of cesarean section for women who cannot deliver in the normal process, there's nowhere you will go to, whether public sector or private sector, that you can have a cesarean section done at 40,000 naira. So that's just a single incident. So really, the objective is to make sure that no matter who you are, you're able to access quality healthcare services. So going into the concept of insurance, general insurance is a concept of solidarity. It's a concept of risk pooling and pooling of funds. I like to use a very simple example, that in our community, the Nigerian society is a society that practices what you call being your brother's keeper. If anything should go wrong in a little community, every member will rally around to ensure that that person gets out of that health condition. In other words, they help and support reducing the financial catastrophe that comes with health conditions. And What are we talking about in health insurance? For the example I gave, if you give at my time, there's no guarantee that I will give at your time. So what health insurance is doing is to put it in a structured manner. The practice that is already common in our society, but having it structured in such a way that when it's your turn, I get. When it's my turn, I get. Because there is that pooling of funds. So I think people just need to come to the understanding that there's a lot of benefit, and it's like preparing for the rainy day.
Rotimi Olatunji, who is in charge of business development, marketing and strategy at Lashma, said although the residents are embracing the scheme, there have been some forms of mild resistance in certain quarters.
Lagos is cosmopolitan, and Lagos caters for residents of the Oyo man, the Ogun man, the Enugu man. Wherever you are in Nigeria, everybody wants to have at least a face in Lagos. So we are not unaware of this pressure, and that is why the best way of approaching qualitative healthcare is to have a health insurance scheme in place. And we have also gone a step ahead to ensure that this scheme is geography biased. You must live within the geography of Lagos State, and you must have a means of identification, which foremost is the LASRA identity card. You could also present your PHCN card, bill, your waste disposal bill, or any form of identification that you live in Lagos State.
What health insurance does, it gives you that peace of mind. As a gentleman that is married, you can decide to travel looking at your job. And you can be at peace with yourself that because you have insured your family, giving them a cover on health insurance, if anything goes wrong, they know exactly where to go to. And you can confidently say where you are, to say, well, just go to, you're already registered in this, so go to the hospital. So there's that peace of mind. There are standards. I said the promise to the people as quality healthcare services. And in Lagos State, you have in the Ministry of Health, you have what you call HEFAMA, which is the Health Facility Accreditation and Monitoring Agency. So what they do is to accredit health facilities. So in other words, give you the license to practice as a healthcare facility. But with the scheme coming on board, their role is extended. So they will be doing the accreditation for healthcare facilities, both public and private, to come on board the scheme. They are being supported by one of our technical partners to develop an assessment tool. It's a quality assessment tool, which considers, minimum requirements, standard requirements. So once you meet that requirement, then you can come on board the scheme. So as I speak to you, we have over about 150, both public and private mix, that have already gone through the assessment, scaled through, and contracted right now to provide services to the scheme. So the fact that we need, it's 23 million people does not mean that you just need to come on board. You must meet a minimum requirement, standard requirement. And it's just not just that alone. That is just to come in. That's the entry level, right, requirement. But there's a continuous quality improvement program that will be going on with our healthcare providers to make sure that they sustain and possibly surpass the standard that they came in through. So once we find out that you are not meeting that standard, you'll be excused from the provider network. Then you fill in the gap. When you're ready, you call in again for a reassessment for you to come back on board.
According to the agency's head of operations, the fact that it is not automatic for all government hospitals to be selected as providers shows that extra efforts have been put into the selection process of facilities that serve in the scheme. Dr. Serrano said the process of getting selected as a service provider for the scheme meets up with globally acceptable standards.
So it's not an automatic thing. And of course, there's a constant evaluation to know whether a hospital remains on the scheme if they're able to maintain that standard to remain on the scheme. But of course, if a government hospital suddenly drops and they're not able to deliver such services, we may have no choice but to ask them to just pull out from the scheme until they're able to meet up to our necessary standards.
As I speak to you, we have over about 150 both public and private mix that have already gone through the assessments, scaled through, and contracted right now to provide services to the scheme. So the fact that we need, it's 23 million people does not mean that you just need to come on board. You must meet a minimum requirement, standard requirement.
A farmer is the unit under the Ministry of Health that ensures quality, and we have ensured that the barrier to entry to become a provider under this scheme is quite high, and we are working a lot with our provider to ensure that they scale up to meet the standard that we require. So undoubtedly, quality will be a thing of importance that we will guarantee, and that's why we are currently ensuring that the hospitals have the necessary thing that is required for them to deliver quality service.
Now, the expectation that those in rural areas will get the same quality as those that are residents within the town. The reason is this: we are using the same benchmark to benchmark all the hospitals, irrespective of location, irrespective of ownership. So it's the same quality standard for rural areas, for cities, and for highbrow areas. So the paracetamol you get in the highbrow areas of Lekki VI is the same paracetamol you get in the rural riverine areas of Lagos. So standards are being maintained irrespective of locality. So same standards throughout.
For the Lagos State Health Management Agency, the journey to a healthy society throws up new challenges at every turn. These challenges, however, must not only be proactively prepared for, they require creative approaches.